Our first community conversation, we're joined by Dr. Heather Spader, a pediatric neurosurgeon with UVA Health Children's. She's sitting down with Aaron.
Dr. Spader, it's great to have you here today. Thanks for coming in.
Thank you.
You're very welcome. So today we're talking about treating craniofacial conditions in children. So first things first, what are craniofacial conditions?
So children who are born with some abnormality of the cranial vault or of the mouth, oftentimes you'll see like a cleft lip or cleft palate. Many of those are dealt with by my plastic surgery colleagues. The ones that deal with the head, the cranial vault, those are the ones that I work with plastic surgery to fix. And so it's called craniosynostosis. And it's when one of the sutures is fused when the baby is born, causing an abnormality of the head shape.
And how do these conditions affect children?
So more than anything, they cause significant deformation of the skull. And so you can have a forehead that looks like a triangle, or you can have a head that is super long or a head that is super wide. And then we also are concerned in some cases that there could be increased pressure because there's a suture that's closed that's supposed to be open, and the brain isn't allowed to grow the way that it wants to.
And how are these conditions diagnosed?
So usually they are diagnosed after birth, and so a lot of women have ultrasounds. They'll never find it on ultrasound. Then after babies are born, the pediatrician notes that this is not the normal progression of the head shape, and then they send them to us.
And what type of treatment options are available?
So for kids who really have a fused suture, and there's a difference. There are kids that have some flattening of the head because all kids sleep on their back, and that is usually resolves over time. Or there's some kids that have significant flattening and they get a helmet. But these kids can't be treated with a helmet. They have a surgical condition that has to be fixed. And we have many minimally invasive options, and so we like to see these kids usually in the first or second month of life. Because before 4 months, we can do small incisions and go in with a small scope and take out the bone that's fused and to help the brain grow in the direction that it wants to grow.
Well, that's good. That is good. And how much follow-up care is needed?
For a lot of these kids, they come from far away. We draw from a very wide region, and so they will come, we'll do surgery, and many times we just see them once a year until they're 5, and if they do well, then we discharge them from our care. So it's kind of, they come to us for surgery, and sometimes they need helmeting and follow-up, and sometimes they do not. But there's usually minimal follow-up. If we catch it and catch it early, they do very well.
That's good. And it sounds like it's kind of like a case-by-case basis type thing.
Correct, yeah. And a lot of these kids, when they grow up, nobody would ever know that they had this condition.
Well, that's good. That's some promising treatment then.
Right.
That's very good. Well, thank you so much, Dr. Spader, for coming in. Great information there.
Thank you for your time.
Appreciate it.